Hi, good morning. My name is Dr. Surakshith Battina. I'm an endoscopic surgeon, a reproductive medicine specialist, and a cosmetic gynecologist working at Indigo Women's Center, Chennai. And today I want to talk to you a little bit about COVID-19 and its effects during pregnancy and what you should expect after pregnancy. So the one good thing about this coronavirus pandemic is that a lot of people have been getting pregnant or they've been conceiving, and there is no reason for you to be concerned, mainly because of three reasons. One, being pregnant does not improve your chance of getting coronavirus, which is very, very important. Many women think because they're in immunocompromised state, they have a higher chance of getting coronavirus, but this is not true. The second most important thing is that even if in case you get coronavirus, your baby is going to be safe. It is not going to have any chance of miscarriage, neither is it going to have any chance of having any kind of abnormalities because of this virus. And finally, the recovery rate for patients who have coronavirus is very, very, very good, which means that even if in case you get infected during the course of your pregnancy, your recovery is going to be fine, your baby is going to be fine, and most importantly, you should only be worried if you have any kind of comorbidities, like if you have uncontrolled diabetes, or if you have hypertension, or you are a cardiac patient. But otherwise, there's absolutely no reason to be concerned. The number of times you have to visit your doctor during this COVID pandemic has also been greatly reduced. The four important times when you have to visit your doctor is: one, when you're at 12 weeks, you need to do your nuchal translucency test, along with which you have to do your double markers and also your blood works. The next most important time is that you have to visit the doctor in your 20th week, where we will be performing your anomaly scan. The next important time you need to visit your doctor is at 28 weeks, and this is the time we will repeat all your blood work to make sure everything is okay. And finally, we visit the doctor at around 37 weeks, and during this time it is very important that you have to get your COVID testing done. So get your testing done either at 37 weeks or maximum at 38 weeks. And finally, the doctor will do an internal examination for you and decide whether we have to go in for a normal delivery or an elective cesarean section. Only emergency situations when you have to visit the hospital are if you either have any kind of bleeding from the vagina, and two, if you have any kind of watery leakage from the vagina, and three, if you're having a rise of temperature along with chills and rigors, and four, if in case you're not able to feel your baby movements at all. This happens only after 24 weeks of gestation. And finally, if you have some kind of pain in the back which is radiating to the front, even if you take any kind of rest or if you take any painkillers, the pain does not settle at all. And these are the only situations when you have to visit the hospital. If you have an affected family member at home who has COVID-19, and if you need to visit the hospital, make sure that your visit is delayed at least by 14 days after the COVID test has been done. And before you enter the hospital, make sure you also test yourself for COVID-19 before you go ahead and get your appointment fixed. Another good thing what we have found is that the vaginal secretions of women who have been affected by COVID-19 do not have any coronavirus. So why is this important? Because the patient will be able to have a normal delivery. But however, some of the institutions might not allow you to have a normal delivery if you have been found out to have coronavirus. The reason for this is because the chances of transmission to others during the normal delivery process is a lot more than when compared to a cesarean section, where it has been done in a controlled environment and where the doctors and the supporting staff, all of them are wearing personal protection kits. And also the spinal anesthesia and epidural anesthesia can be given for patients during this time. However, general anesthesia should be avoided at all costs. Finally, coming to breastfeeding, is it safe to breastfeed your infant if in case you're corona positive? Coronavirus has not been found to be present in the breast milk of women who are COVID-19 positive, and this is a very good sign. So this shows that women who are COVID positive can breastfeed their infants, but definitely they have to take certain precautions. They have to make sure they wear a mask. They need to wear a face shield. At the same time, they need to clean their breast with soap water at least 3 to 4 times before they can feed their baby. although the baby has a chance of getting coronavirus from its mother due to breastfeeding, the benefits of breastfeeding are much more greater than its risks. For example, the baby will be able to get the necessary nutrients, the necessary immunity from the mother, and as well as the bonding, which is very, very important between the mother and the baby, happens only because of breastfeeding. And all of these benefits outweigh the risks, wherein a baby who is affected by coronavirus has such a good recovery rate that the benefits of breastfeeding should not be taken away from this particular baby. However, if the woman does not want to risk the transmission of coronavirus to her baby, she can always express a breast milk with the various breast pumps which are available, and using these breast pumps she can express the milk, and this express milk should be collected in a well sterilized bottle and then can be fed to the baby. So I hope you find this video useful. If you did, kindly subscribe to my channel. I am at Dr. Surakshith. I am also present on Instagram and on Facebook, and if you have any queries, feel free to contact me. Alright, until the next time, stay safe, stay indoors, and we can all beat this together. Alright, take care guys. I'll see you in the next one. Thank you.